So today we are going to be talking about Susie Smith and her lab values. For her tropin, it normal range is less than 0.35. I found this on the textbook on page 492 to 493. Her lab results, on her first day was 0.12, her second day was 0.35, and her third day was 0.50. This is trending upwards, so I put an up arrow. Possibilities for this that I think for clinical significance would be possible cardiac injury or cardiac injury. For BNP, the normal range is for under 100. I have this in lecture. Hers is 842, so hers is very elevated. They didn't have anything for day 2 or day 3, so there wasn't really much of a trending to show up or down, but it is elevated. And possibilities of this are heart failure, and then age will also play a role in that as well. Next, I have sodium. The normal range is 135 to 145. I found this on the textbook 467 to 469. Her ranges on the first day was 138, 136 for the second day, and 134 for the third day. So it is actually trending down. This is for diuretic use, possible headache, and then some tremors you have to pay attention for that can cause seizures. For potassium, the normal range is 3.5 to 5. I found this on page 426 to 428. On the first day, hers was 4.2. The second day was 3.8 and then 2.6. So this is trending down as well. For this, I put for diuretic use, observed for higher heart rate and confusion, and then lower blood pressure. For chloride, I found this on normal range is 96 to 106. I found this on page 153 to 154. Her range for the first day was 102, the second day was 100, and then the third day was 98. So this is also going to be trending downwards. Something to note for this is IV infusions that she has can be interfering with this, and something to pay attention for is weakness and edema. Her CO2 regular levels would be 23 to 30. I found this on page 487. Her ranges were 24, 22, and 23, which is actually really good. They are in the normal ranges. Some things to look for are diuretics. They do play a role in this. And then respiratory acidosis for when she was complaining of chest pain. BUN, the normal range is 8 to 20. I found this on lecture. Her first day was 15, her second day was 18, and her third day was 22. So it is going on an upward trend. This can lead to congestive heart failure. And then also something to pay attention for is if she is hydrated or dehydrated. Creatine, 0.6 to 1.2 is a normal range. I found this on page 198 to 199. The first day she had 0.9. The second day her level was 1.2, and the third day her level was 1.4. This is an upward trend. For this one, you would want it to monitor her fluid balance. And then I noticed that diuretics also play a role in this. For glucose, for a fasting glucose, it would be 60 to 110, and then for 2 hours after eating, it should be anywhere from 65 to 140. I found this on page 317 to 318. Her glucose readings on the first day was 105, the second day was 110, and the third day was 125. This is actually really good for her. This shows that she is maintaining a good glucose level. For total protein, normal range is 3.5 to 5.5. I found this on page 430 to 431. Her day 1 was 7.0, day 2 was 6.8, and day 3 was 6.5. This is showing a downward trend, and some significance that I found was this could show of diabetic ketoacidosis or infections. Albumin, I have 3.5 to 5.5. I found this in the lecture and in the textbook on page 32 and 33. Hers was 4.2, 4.0, and 3.8. So this is a downward trend. So this is all within normal range. This can indicate that protein is being absorbed, or her liver and kidneys are okay. Her AST in normal range is 10 to 40. I found this in the lecture. Hers was 22 on the first day, 30 on the second day, and 42 on the third day. This is an upward trend, and some significance would be the diuretic use can play a role in this, and also muscle trauma. I put muscle trauma because there was a possibility with her chest pain that she did do something with muscle. Her ALT normal range is 10 to 40. I found this in lecture as well. The first day was 25, the second day was 32, and the second day was 32, and the third day was 45. This is an upward trend. This can be anywhere from lack of oxygen, and then something to watch for would be low BP. Total bilirubin, I have 0.1 to 1.0 for normal range. I found this on page 85. Hers was, for the first day, was 0.6, 0.8 for the second day, and 1.2 for the third day. This is an upward trend. Hers is right outside the normal range, so for this, it can be very specific to light. So if it's exposed to light, it can throw the test off. So I put that down because it was like right there. Alkaline phosphatase is 50 to 120. I found this in the lecture and on page 35 and 36. Her first day was 130, her second day was 128, and her third day was 133. This is an upward trend, and age does play a factor in this. And then also cirrhosis. I put this because of her chest pain as well. Procrastination is 0.0 to 5.0. I found this on page 117. Her first day was 0.21. They did not have one for day 2 or day 3, so there was no really trend, but it is within the range. Something to pay attention for this is for her food ingestion, like before taking the test, and then while doing this, an IV would be needed. White blood count, I have 4,000 to 11,000 for normal range. I found this in the lecture. Her first day was 7,200, her second day was 12,500, and her third day was 17,000. This is an upward trend, and this does show a sign of infection. This can also play a role in stress because of her workplace. Her HGB is a normal range is 14 to 17.4. I found this in the lecture and on page 321 to 322. Her first day was 13.5, her second day was 12.8, and her third day was 11.2. This is a downward trend. This could be from dehydration or having a high white blood count, which she does have. Her HCT is 42 to 52%. I found this in the lecture and on page 320 to 321. Her range on the first day was 40.2, on the second day was 38.0, and her third day was 35.5. This is a downward trend, and this could be from anemia or leukemia, Hodgkin disease. I put those on there because of the chest pains, because they're all signs of that. Platelets would be 110,000 to 400,000. I found this in the lecture and on page 418 to 420. Her first day was 150,000. Her second day was 288,000, and her third day was 410,000. This is an upward trend. For this, there is infections and also Lasix do interfere with this, and she does take Lasix as well, so that could be a possibility. For Nuphilus is 56.5. I found this on page 99. On the first day it was 60, on the second day it was 75, and on the third day it was 78. This is an upward trend, and this could mean infection or inflammation. Her lymphocytes are at 16, or normal range is 16.2. I found this on page 100. For day 1 it was 30, day 2 was 18, and day 3 was 15. It is a downward trend, which also it could also mean infection, or she doesn't have the right diet, so she does have some deficiencies. Monocytes, a normal range is 8. I found this on page 100. On the first day it was 8, on the second day it was 6, and on the third day it was 5. This is a downward trend, and this can also lead to infections and deficiencies. Eosinophilus is 3.1 for normal range. I found this on page 99. On day 1 it was 2, on day 1 it was 2, on day 2 and day 3 it stayed at 1. This is a downward trend, and this could be due to infections and stress again because of her workplace. For Bacillus, it's 0.01. I found this on page 100. On day 1 it was 0.5, day 2 it was 0.5, day 3 it was 0.5. This actually remained the same overall, but this can be due to infection and stress. Then her lactic acid of 0.5 to 1 for normal range. I found this in lecture and on page 81. Day 1 it was 1.5, day 2 was 1.4, and day 3 it was 0.03. This is a downward crease. This would lead me to check her liver and as well as oxygen supply. Her D-dimer should be less than 250 for normal range. I found this on page 213. On day 1 it was 300, day 2 they didn't have anything, and day 3 it was 620. This is an upward trend. This could be a possibility of DIC or venous thrombosis. For her TSH is 0 to 15. On here, on the book, I found it on page 484. On day 1 it was 2.3, day 2 it was 2.8, and day 3 it was 3.1. This is an upward trend, and this can be normal, but also if she does take aspirin, it can interfere with that. Her T4 is 5.4 to 11.5. I found this on 485. On day 1 it was 1.1, day 2 it was 0.9, and day 3 it was 0.7. This is a downward trend. This could just be from genetics, or she could have hypothyroidism that's just not diagnosed, but I would say that it was more genetics than anything. And then for the last one, for calcium scoring, you want a 0. And I found this on page 118 to 120. For all 3 days, it stayed at 150, which is really high. So this just means plaque buildup, but something to pay attention for would be heart disease.